a scene it was this weekend as Americans tried to do the right thing. President Obama decided to declare the epidemic a national emergency of swine flu. And around the country, people were lining up waiting for hours to get vaccinations. But there are only 11 million doses available, far short of the 40 million expected by this time, and the 150 million the government says will eventually be needed for everyone. ABC's Lisa Fletcher has been there where the lines will be forming again.
Around the country, tens of thousands lined up for swine flu vaccines, hoping to get a shot before being shut out.
No more. This is the cutoff point.
We're being turned away when we're told that they don't have any. My children's health at stake.
We've been in line for 5 hours today.
It's all done.
One of the biggest fronts in the battle, Los Angeles County, where 20,000 doses were given just on Saturday, and it couldn't come fast enough.
We knew it was limited, and we kind of braced ourselves, but still, you're never really prepared to wait 4 hours, in a car.
The LA County Health Department reports 3,000 doctors ordered the medicine and only 400 have received it. In Chicago, 7 clinics used every drop they had and ended up turning people away.
If we had more supply, we could give it to more people, but we don't.
In fact, the government said 40 million doses would be ready by now. In reality, it's about 1/4 of that.
I think the problem has been the manufacturers have been overly optimistic, and it's made planning much more difficult.
46 states are reporting H1N1 as widespread, with more than 1,000 deaths and 20,000 hospitalizations. And while an average case is usually no more dangerous than other flu, this strain has its unknowns. 30% of the deaths are in healthy people with no underlying problems. And one more example of vaccine panic. A West Virginia mother allegedly stole a vial of the vaccine. She wanted to get the shot with her children, but the clinic informed her that at age 25, she was a year too old to qualify. Diane?
All right, Lisa, thank you. Well, what does the administration think about this scene around the country? And is it getting too late to bother getting the swine flu vaccine? We put that question and others to Secretary of Health and Human Services, Kathleen Sebelius. Does it upset you to see those pictures?
Oh, absolutely. I mean, I never like to see people inconvenienced. I think that I'm pleased that the American public is eager to take advantage of this, vaccine breakthrough. And if we had found the virus a little earlier, we could have started a little earlier. But to remind people, this virus wasn't found until the end of April, and here we are at the end of October. We have a vaccine that works, and that's good news.
Purdue University has issued a study which says that by their calculation, their metrics, the peak of the flu will be by Halloween, just a few days from now. Is it too late to wait in these long lines?
Well, I don't think it's too late. Flu season has just begun. The 1st of October was the launch of flu season. What we saw in the mid-50s with, again, a pandemic spread was that there was a big outbreak in the fall. It died down for a bit, and then a new wave in the spring. What we saw this April with H1N1 was a big burst of flu, a little bit of lower numbers, and then another big burst of flu. So I think that getting vaccinated, even if you've had the flu in the summer or early fall, our scientists tell us that's a good plan.
I know concern has been expressed that 4 out of the 5 of the manufacturers of the vaccine are overseas, not in this country.
That's right.
How did this happen, and and should it be changed?
Well, there certainly are investments being made at the federal level in more vaccine production capacity. There is, in fact, an additional plant that's going to come online in the United States in 2010. But certainly it's a concern that we rely on other nations to purchase the vaccine. What the United States did under the president's direction was immediately move to lock in orders. So we had 5 companies to deal with. We immediately went out at the president's direction and negotiated contracts on behalf of the American people with the 5 manufacturers. Diane, just as recently as 2004, there were only 2 vaccine manufacturers in the world. So we really have seen a growth in capacity. A lot of the fill and finish lines are here in the United States. It's just the production capacity is still scattered around the world with only one here in the U.S.
But to come back, before I let you go, to this question of people waiting in lines and the vaccine not available once they do. So what do you say to families who've gone, waited, couldn't get the vaccine? What do you want them to do for these days
I
while
want
they're
them to
still...
come back. I hope that people aren't discouraged, and I know it's frustrating to wait in line, and particularly if you end up with no vaccine. And we wish that this could have been smoother, that we had a larger supply available for everybody on day one. We knew that it would come in waves, and the waves have been a bit slower, but talk to your local health official, go on the website, get information at the local level, and come back.
Secretary Sebelius, again, thanks so much for joining us.
Good to talk to you.